Thanks for joining us. I'm Manesh Patel from Duke University, and I'm here at the Heart.org booth at the American Heart Association meetings in 2012. With me, joining me, is Dr. Stuart Connolly, who is going to be presenting the PALLAS study results here today. Dr. Connolly, thanks for joining us.
Pleasure.
Can you tell us the rationale for this study design?
Yeah, the PALLAS study was in part based upon the very impressive results with dronedarone in the ATHENA trial, where we saw not just prevention of recurrence of atrial fibrillation, but reduction in major vascular events, including cardiovascular death and stroke. We also saw that there were some patients with permanent atrial fibrillation in that trial who seemed to have a similar benefit, although there was a very small number of them. Knowing that dronedarone reduces heart rate in atrial fibrillation, reduces blood pressure, has antiventricular arrhythmia effects, and other potential beneficial effects, we hypothesized that it could have very important effects in permanent atrial fibrillation.
Wonderful. So can you describe for us what you found?
So we mounted a clinical trial in fairly high-risk permanent atrial fibrillation patients. They'd all had permanent fibrillation for more than 6 months, and that we selected a group with a very high burden of vascular disease because we thought these were the patients who might benefit the most. So most patients had some major vascular event in preceding enrollment into the trial. It's a very standard sort of study, a randomized, double-blind, placebo-controlled trial on top of usual care of these patients. The study was stopped early after a mean follow-up of only 3.5 months with about 3,200 patients. And it was stopped for safety reasons, and when we did the final analysis, we can say clearly that there was an increase in death, there was an increase in stroke, and there was an increase in heart failure with dronedarone in this specific population.
So why do you think that happened?
Well, that's the $64,000 question. How could the results of PALLAS be virtually diametrically opposite to those of the ATHENA trial? And, to be honest, we don't have a really compelling, easy answer. There's no particular subgroup in PALLAS that were at particularly increased hazard, and there was no particular subgroup in ATHENA that didn't benefit. So, go figure. The striking thing, of course, is that the patient populations are different. One group has intermittent atrial fibrillation, where dronedarone can restore sinus rhythm. In the PALLAS study, the patients were permanent, and we didn't see very much atrial fibrillation going back to sinus, just a few patients. So that was one big difference. The other big difference was the burden of vascular disease. Although patients in ATHENA had risk factors for vascular events, they mostly did not have established vascular disease, whereas the opposite is true in PALLAS. So it seems to be those two factors, the permanent nature of the atrial fibrillation and the burden of vascular disease. Which is more important? Are they both important? We're not quite sure, but that seems to be the message.
And so what do you message for clinicians now taking care of patients with atrial fibrillation? What's sort of going to be their take-home when they hear about the PALLAS trials?
Well, there's a couple of easy take-homes, one of which is this drug should not be used in permanent atrial fibrillation. And it should not be used in patients at risk for heart failure, because we see a clear increase in heart failure episodes and heart failure hospitalization. The question is which patients can continue to receive dronedarone safely and receive benefit from it. Those would appear to be patients who have intermittent atrial fibrillation, are not at risk for heart failure, and probably don't have a very extensive burden of vascular disease. The latter is not so clear, but certainly it's for atrial fibrillation patients, probably focusing mostly on the symptomatic cases.
Well, thanks for sharing the results of another important trial with us.
My pleasure.